So again, my name is Brigette Mettler. I'm the Regional Lead with the Physician Information Technology Office, also with the BC Medical Association, and we are now operating as the Doctors of BC. I'm also a master's student of Health Informatics at the University of Victoria. I'm one of my professors here today, so hopefully I'm not getting graded. I didn't know about that. With me is my esteemed colleague, Dr. Leo Wong from Langley, BC. He is one of our highly valued physician peers. Leo and I are here to give you a brief overview of what our province has been up to in regards to increasing meaningful use of electronic medical records, particularly through the lens of peer impact. I'll give you a quick high-level overview, and Leo will share a more detailed look at how EMR has impacted adoption, interoperability, and peer support in his community. So here we go. PEDO is proud to announce 73% EMR adoption rate of eligible physicians in our province, 87% if you're looking at our target physicians. We started with approximately 15% adoption in 2006. A lot of the success was due to peers such as Leo supporting his colleagues through the journey to EMR. The EMR vendor market share is fairly consistent across the province. As you can see, we have approximately 7 vendors sharing about 90% of the market share. Now that we have this uptake, we can also help with interoperability as well. So this graph and more detailed information is available on our website. With such high adoption rates, physician focus soon shifted to requests for support to increase their level of EMR use. A lot of these triangles around, by the way, I've noticed this. These requests for support were quickly answered by the development of our Post-Implementation Support Program, PIS, and our Clinical Value Model, CVM. This is our clinical value model. As you can see here, it has level 1 at the bottom, starting with just basic office use, front office automation, going right up to levels 5 with even community shared care and proactive data care. So it's all good there. This program includes an assessment tool, subjective and objective measures, and support plans to determine where a physician needs support and where they would like to go with their support system. This is used in order to increase their efficiency, their effectiveness, and their satisfaction with electronic medical records. Our program is also working with vendors to develop tools such as the Objective Data Dashboard. We call it the ODD. We have a lot of fun in British Columbia with acronyms, by the way. PIS, ODD, it's all good. This will help physicians self-assess their level of use. Personalized coaching is available from our practice automation coaches, and it's provided to ensure that there's a sustainable, successful, and supported process in place. Physician MOA peers have been critical to this success. And as we pair those in need of the skill set with those that actually have the desired skill set. It's really nice also that we have some incentives. We have $3,000. There you go. $3,000 for physicians who reach meaningful level use 3, and there's also CME credits for participating in the program. Our support program is having an impact. We have assessed and supported approximately 1,000 GPs so far, and over half have met meaningful level use 3 or higher. This is an example I wanted to share with you. These are 3 physicians from my area that I've been working with for approximately 3 years, and I was of no use. Just recently, they each had an assessment, peer support, and with 3 months had doubled their level of EMR use. These are amazing impacts. Early success has shown these positive impacts, and measurable results are increasing the level of use and efficiency of electronic medical records. We've also engaged in robust evaluation after each support cycle, which has shown the majority of physicians rating the program as either good or excellent. This program continues to evolve, it's still early days, as we get feedback. We currently have 62 MOA and 68 physician peers who lead communities and provide support for those in need. Peers lead and provide support on adoption, vendor selection, workflow, efficiency, and effectiveness of EMR. Last year, we issued over 731 statements of work. That's our way of tracking peer interventions. It is actually this database that I'm basing my final paper on. In northern BC, I have used peers to help me cover the vast geography of my area. nearly 2/3 of the province. MOA peers can be particularly helpful as their capacity to support can be higher. Some of them only work part-time. And they have an incredible understanding of workflow and impact of EMR and practice. I presented on the MOA peers as hidden gems at recent eHealth, and with us today, actually traveling from British Columbia, is our MOA peer lead, Barbara Asen. Barb, if you could just pop up for a sec so they can see you. We've sent Barb to all corners of the remote parts of British Columbia. We're so sorry. But she's quite fantastic, so if anybody wants to chat her up about her experiences. Recruiting, training, and supporting these peers has enabled me to increase my capacity, and therefore the adoption in these remote areas to over 90% of the North. Physicians like Leo have enabled these achievements, and he's here today to share with you his experience with EMR, peer support, interoperability, and where his community would like to go next.